We're spending a year with Amy. Amy's one of my colleagues, spending a year developing an innovative care delivery model that will improve patient experience, lower healthcare spending, and reduce population-wide disability. So we're looking at improving the healthcare system.
So far, I've really enjoyed meeting and hearing patients that are really actively engaged in the healthcare system, and I think we can take away a lot from that in designing our healthcare model that's really going to be incorporating their voice.
Do you have a favorite speaker or something you've heard?
I really liked Regina because she was super powerful and energized and she was very dynamic, very powerful, and her story was very compelling.
I just wanted to see new innovations in the healthcare space, and I think that Stanford's a good place for that because it's so close to Silicon Valley. There's so many innovators here. People are open.
What things do you think you'll take back to your practice, to your patients from the conference?
I think I learned a lot about patient communities, and I think that that's really important. If I have certain patients in certain communities, I've actually already done this. I have a patient that just was newly diagnosed with Crohn's, and she was doing all that with her internist, and I told her about chronology, actually, because I learned about it from the patients on Twitter.
And do you guys have things that you'll bring back either to research this year or research later or patients later?
Well, specifically, we are looking to redesign delivery in stroke care, and I think engaging stroke patients, which are basically it's a chronic condition, is really important, and then learning how to activate them to improve their medical adherence and kind of their ability to self-identify as stroke survivors in order to educate and reach out to other patients, as well as being able to, for example, go to the emergency room when they're having stroke symptoms. I think all of that is really important.
And is there an app or a product that you've seen here that you think you'll use in the near future?
I mean, we've seen a number of different ones. One of the things that we're learning is, somebody said today, patients are people, doctors are people. We need to make things that work well for people. Not even necessarily thinking about whether it's patients or doctors or whomever, but just thinking about like the way that people like to interact with their surroundings and with technology. It's often not user-friendly, and so just the idea of patient-centeredness is also like human-centeredness or just friendliness, sort of, and that I think is really fun to think about because our environments, especially in healthcare, are not like that right now.
Any other changes that you think you might make to your practice based on things you see here?
I'd like to connect with a lot of the people here, and it seems like there's a lot of thinkers, and I just would like to talk to them more, really, and because everybody's into innovation, it's an exciting place to be.